Italy, which has recorded fewer than half the number of infections as China, has now overtaken China's death toll. 427 people died in Italy in the past 24 hours, taking Italy's total to 3,405, 156 deaths more than China. Well, Spain's numbers are rising rapidly too, more than 100 dead in the past day, while Iran's health minister said, on average, one person there dies from the virus every 10 minutes. Michel Barnier, the European Union's chief Brexit negotiator, has tested positive for COVID-19. The 69-year-old says he's doing well and is following the necessary instructions. And on a positive note, China has recorded its first day with no person-to-person infections. We begin our coverage with this report from Paul Brennan.
The head of the World Health Organization has called coronavirus the enemy of humanity. In this intensive care unit in the Italian city of Bergamo, it's easy to see why. This footage, filmed by the head doctor, gives just a glimpse of the life and death struggles taking place across Italy and across the world. All 80 beds here are occupied. It's a crowded, frantic, overwhelming place. The system is on the brink.
100% di saturazione.
100% saturation. Normally out of these 80 beds, 3 or 4 recover and can leave on a particular day. And normally we are then forced to bring in 3 or 4 others. So we have a very precarious and difficult balance.
Isolation is a cold, hard necessity. Family members cannot visit here. They cannot comfort or support. COVID-19 brings a solitary death.
This is
perhaps one of the saddest things, but we know that during epidemics, the only way to save those who are outside is to not allow contact. We try where possible to let them talk on their cell phones or video calls, but sometimes they die when they are still intubated, so the call cannot happen. We know that isolation is a very important sacrifice, but it is needed so that people outside will not get sick.
Temporary field hospitals try to relieve the pressure, but the epidemic is roaring through the population here and the doctors are struggling to keep up. The widespread shortage of medical supplies is having fatal consequences for the staff. In Codogno, a doctor who was forced to work without wearing gloves has now died of the virus. In Bergamo province alone, 110 of the 600 medical staff have fallen ill.
We are in full emergency with this coronavirus pandemic. Our health personnel, nurses and physicians are working round the clock, countless hours to fight this incredible situation. We do not know how long this pandemic will last.
Under current measures, Italy's 60 million people are only allowed to travel for work, medical reasons or emergencies. And most shops, except groceries and pharmacies, are supposed to remain closed until March 25th.
You see very little people around. We are following on TV, internet situation, but on the other hand, we try also not to be overwhelmed by information. It's a danger there.
Elsewhere, though, the restrictions have not been so strictly observed, and faced with no visible slowdown in the pace of infections, the lockdown is set to be tightened further and the deadline of it extended. This crisis has been compared to a war, and at the moment, the virus is winning. Paul Brennan, Al Jazeera.